Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now, here is your host and founder of Laser Therapy Institute, Dr. Jason Rountree.
All right, welcome back again to another episode of Healing at the Speed of Light, your weekly laser therapy podcast. My name is Dr. Jason Rountree, and I'll be your host, but I have a special guest on the show today. This is Dr. Agnieszka Cluchey. We've actually had her on the show before to talk about acute conditions and laser therapy. And today we've got her back on to talk about post-surgical pain, the problems that can happen with even successful surgeries, what to do about them, how laser therapy can work. So Dr. Cluchey, welcome back.
Yes, thank you for having me again.
It's good to have you. So, you've seen a lot of these conditions in your clinic. I know, of course, I have too. But let's just talk a little bit, when you say post-surgical pain, any number of different things might come to mind for a patient. But what kind of conditions are we talking about when we say post-surgical pain? What does that really mean?
Post-surgical pain can be anything from pain that patients are experiencing immediately after surgery, once they're starting to wean off of their opioids or any kind of pain medication, or once somebody is starting physical therapy. There's different pain associated with that. Once people are starting to increase activity, there's pain associated with that as well. And then there's certain complications that can happen post-surgically, such as scar tissue problems. Some people with scar tissue development, for example, a knee, if somebody has excessive amount of scar tissue or they're not attaining the range of motion that they need, and they can go under another procedure that's called a manipulation under anesthesia when too much scar tissue is formed and not proper range of motion is attained. So there's a lot of different types of problems that could occur along with pain as well.
Yeah. And of course, depending on the type of surgery that's being done to the patient themselves and their activity level, there's so many factors that go into recovery post-surgery. If we're talking about orthopedic surgeries in particular, what do you see most commonly with, say, a joint replacement? What do you see patients have the hardest time with?
I would say swelling and inflammation, because they're pushed almost immediately with physical therapy. And during physical therapy, they want to attain that range of motion somewhat quickly so that they can get into strengthening or elongation of the muscles and then slowly strengthening of the muscles. So I would say that's number one is excessive amount of swelling, redness, sometimes inflammation, sometimes lack of healing around the incision itself is something that's common.
Yeah, I've seen that one also. There's always, of course, risk of infection with any kind of surgery, but especially if the tissues are swollen, like you're saying, and there's inflammation there, it really inhibits the body's repair effects and the immune system effects on the body's efforts to repair that area. And that just generates even more scar tissue on the long run, assuming it does heal up well. There's a number of issues with going into physical therapy too early. There's, of course, issues with not going into physical therapy early enough, and it's definitely a balancing act. Have you been able to work with some patients who are doing physical therapy at the same time?
Yeah, so most people that I see, the most common post-surgical case that I've seen is knee replacements. And so those patients are usually in some type of physical therapy setting, whether it's home initially, and then into outpatient within a week and a half. So as soon as they have their they usually already from the get-go have their 21 PT physical therapy treatments already signed up. And so we'll usually work around their physical therapy schedule 2 to 3 times a week. So they're getting what they need on the physical therapy end from lengthening and strengthening, and then on our end to help promote healing within that area, or sometimes even areas that they start to compensate in, right? Above the surgical area. So in the thigh and the hip and the low back area, that's very common to see as well.
That's a good point. It's not just the area that was actually operated on, but multiple areas are affected. Of course, if you had a knee replacement, you're going to spend a good bit of time not putting weight directly into that or not utilizing it at full capacity. And that weight has to go somewhere. You have to put pressure on that opposite side. It changes the way that people walk. And yeah,
Yes,
it definitely has some associated issues for sure. For sure. How many treatments do you find that you usually need to do? Of course, we're talking laser treatments here, but how many laser treatments do you find typically are needed for some of these slow to heal or even just kind of standard post knee replacement cases?
I would say the slow to heal and for the overactive patient, because there's some patients that immediately, okay, I feel better 2 months post surgically. I want to go for my walks. I got to get up and down the stairs. Those are the ones that need a little bit more treatment because they're already becoming too active on those still very tender tissues and very overworked tissues from physical therapy on one end and underworked because they just lost their strength post surgically. So there's kind of the balance between strengthening and healing. So those patients typically need more. I would say anywhere 12 to 15. The patients who do what they're supposed to do with physical therapy and keep their activity levels fairly mild to moderate, I would say anywhere from 10 to 12. And then it depends because some patients then they do start to notice compensation in their ankle or in their hip or their low back. That's another really common one is sacroiliac pain with post knee surgery. So it just
Yeah.
depends what's going on with them.
Yeah, no, that's a good point. You know, and that to some people that may sound like a lot, but you have to consider you're talking about a replacement in this case. You can only typically have 2 of those. So if you mess this up, if you mess up your knee replacement right off the get-go, you already worked into kind of your max of what can be done. It's really critical to make sure that knee replacement recovery goes smoothly, goes well, and you come out with very, very good abilities, not only to make sure you get the best results out of your surgery that you can, but also to, like you're saying, avoid some of these compensations that can come out of that.
Correct. And like I said, most people after knee replacements are already signed up for 21 physical therapy visits. So that's, I always show them, okay, you have 21 visits that a physical therapist is going to work with you just on the tissue lengthening and strengthening, and we are going to work alongside with that physical therapist on the healing aspect to make sure that you are properly able to strengthen that area so you can go back to your activities that you enjoy.
Yeah, that's great. Awesome. What about so that's kind of the real common knee replacements. I will say, knee replacements when done in the right circumstances have very, very high success rates. As far as the literature shows, 90% plus success rates. I will say that a surgical success in all cases is defined as about a 30% or greater symptom improvement at the 1-year mark. So, in some cases, what might be defined as a success is still an operation that may have some residual symptoms.
Mm-hmm.
And you've probably seen this too, I would guess, but I've seen a few patients who have had the knee replacement done and do have improvement, but not as much as they were hoping. And then they're kind of lost as far as, well, I did my PT and the surgeon said everything looks fine. What do I do now?
Yeah.
Yeah. We've seen a number of those people. And I think that goes for hip replacements as well. But for those patients, it might be in the chronic stages. Maybe they're 2 years out. They're kind of stuck with some level of dysfunction, some level of pain associated with that replaced joint. Have you been able to see some success with those patients?
I haven't seen so many of those cases as I have patients who notice that, okay, my one knee has been replaced. Now I'm really realizing that my other knee hurts a lot. So I've actually seen, but I also live near a retiree community that is very, very active. So they are going back to their pickleball and golfing and hiking and everything. So they want both their knees or both their hips to feel equal. So, and a lot of people do wait quite some time before they even entertain the idea of getting a replacement of any kind, let alone 2. And so most people are actually even doing them back to back just to get one and then get the other. So I see more of those
Wow.
types of patients.
Yeah. Well, very important, especially if doing both, to have good recovery for sure. You definitely want to come out of that functioning
Yeah.
well. So spinal surgeries are one, low back surgeries in particular, ones where you can see some residual levels of nerve damage, nerve irritation, things like that. Patients going in with that kind of classic sciatic pain, coming out of surgery, um, oftentimes with still some level of either sciatic pain or nerve damage. And that can be frustrating because they've often been told there's not a lot that can be done. Have you worked with any patients who have had kind of residual pain after a spinal surgery?
I have, and I've even had a patient who ended up having drop foot post-surgically due to, trauma during the surgery. Right, one of the nerves were nicked, and then he didn't have drop foot prior to surgery. He just had localized low back pain that was due to a compressed nerve, and then came out with the drop foot. So being able to slowly rehab a patient back like that definitely takes a little bit longer than somebody who's just having localized pain. Or I'll see patients who are coming in 5 years after low back surgery, and the pain is coming back just the level above or the level below, or even the same level, just the other side. So I do also a lot of patient education and explain to them what surgery is and what it isn't, right? Surgery is not actually fixing anything. It is just cutting away a portion of the tissue in the disc or the surrounding area that's compressing on the nerve. And they're just removing it. So no correction is being made. They're not necessarily in all circumstances leveling out the spine or fixing compression due to a structural issue. So there's a lot of education that goes in that too, so that patients have proper um, understanding and expectations about how they're going to heal after surgery, or even years after.
I think that's so important. That's a great point. The surgery does not does not heal the body. It should get the obstacles out of the way, but then you really still do rely on the body's process to heal that up and to repair those areas, which, I mean, as I think is why laser can be such a great tool, because it just accelerates the way the body heals, even in that post-surgical environment. Yeah. How about what should patients be aware of if they're dealing with like some type of post-surgical condition, post-surgical pain? They're wondering what can be done and if laser is a choice for them. Are there any people, any patients that really can't look at laser as an option for a post-surgical condition?
No, really, we could see anybody, whether it's been a week after surgery or a year or 10 years after surgery, and people are noticing any kind of pain, discomfort, numbness, or tingling, or even if they're still a year later noticing any kind of swelling in and around the area, or or even pain. We can help
That's
with all
that's
those symptoms.
that's really good. I will say that if you've got hardware that's been put in, whether it's a joint replacement or plates and screws or even a spinal fusion, um, there are certain therapies that you just cannot do. Vibration plates, ultrasound, therapeutic ultrasound. You just cannot utilize those therapy modalities anymore at that point. But laser, because it is non-invasive light, you can use that around any of the hardware, any of the joint replacement pieces with no fear that it's going to damage the stability of those areas or do anything to the hardware itself. So we talked, that sounds a good bit about the orthopedic side. What about the abdominal side? Have you worked with any patients with post-surgical issues with abdominal surgeries like hysterectomies or appendectomies, things like that?
Sure. So I've worked with um, three different types of, more specifically, three different types of conditions. Post gallbladder surgery, a lot of people still have pain post gallbladder surgery. Um, so that's one. C-section, right, which is an external incision, and then also post hysterectomy, which is an internal incision. But all three different types of patients still exhibit pain. And then you have your inguinal or your umbilical hernias as well. for primarily in male patients. So all 4 patients have had great success post-surgically. And actually all 4 of those patients who had laser therapy, and when people come in, they're usually coming in like a post C-section, post hysterectomy. Those patients came in within 3 days of their surgery. I mean, they had a handful of treatment. They only had average 4 to 6 treatments, and they had very, very quick turnaround. The patient who had the C-section, this was actually her 3rd child, and she had to have an emergency C-section. So she's had pregnancies before, just never any C-sections. Her friend actually had a C-section 2 months prior to her. This patient who had the C-section, we started lasering her 3 days after her C-section. She had 6 laser treatments. After the first laser treatment, she noticed she didn't need her Motrin anymore. She was so amazed that she could take care of her kids and that's just after 1 treatment. So after 6 treatments, she compared herself as to 100% back to normal, being able to take care of her newborn and her 2 other children, whereas to her friend at that time, who had already been several months behind her, was still exhibiting pain and discomfort and still on Motrin. Until this day, it's almost a year now, and to this day, she is 100% perfect post C-section. Yeah, and we were able to reduce excessive scar tissue buildup around that site as well. So she had a phenomenal success. She even had friends and family over shortly after, and they're like, "How are you running around?" She's like, "Well, I had this amazing laser therapy done, and I was able to get back to, I was able to nurse my baby without wondering whether the Motrin is going through the breast milk," and she was able to function at a very high rate. And all these patients too, once they all went for post-surgical checkups, even the males with the hernias, their surgeons are very, very impressed and amazed at the rate of healing that they're able to attain.
Wow. That's so exciting. That's
very
really
exciting.
Yeah. The numbers are really, really terrible for use of NSAIDs, things like Motrin and ibuprofen, in the use of post-surgical conditions and pain in general. But estimates are just billions of dollars in cost from the complications of using NSAIDs. There's other issues with that too, long-term organ damage, and like you were just saying, being concerned about what the baby's getting in the case of a mother who's nursing. So to be able to get somebody off of the over-the-counters like that, it doesn't sound like much to some people, but that is a big deal. That is so important.
Yeah.
It's great to be able to have an option like that. So if a patient's looking at doing this, they're hoping, to be able to get some good relief. Tell us a little bit, how long does a treatment like this take, whether it's for abdominal or orthopedic? How long does the patient have to come in to be in the office for? Is this something that insurance will cover? What's your experience with those things?
So I would say average treatment time, it would be about 15 minutes. And sometimes it could be 6 to 8 minutes. Sometimes it could be 10. It just really depends what areas we're taking care of. It depends on level of patient's discomfort and tolerance to laser as well. I would say in terms of insurance, most insurances do cover laser therapy to a certain degree. Medicare is one that is not covering, or the secondaries are not covering laser therapy. But patients, once they see the results from somebody else, they're willing to make the investment because they see the long-term effects. I even recently had a patient that came in and said, "You know what, doc, I know I could have gone to my medical doctor with this and I would not have had to pay almost anything." He's like, "But I know that he couldn't help me. And I know that you could have helped me with this." And indeed, he came in with some leg pain, and it was 4 treatments, and he had full range of motion and felt great. So it was, very cost effective in terms of what you're getting.
That's awesome. Very good. Well, I know you're there in Illinois. Why don't you give us your contact info, your website, so that patients, if we got a patient near you that's listening to this right now, if they want to know how to find you, how can they get a hold of you?
Sure. We are in downtown Main Street in downtown Galena. We're on 310 North Main Street, right next to the police station. which is a very good location to be in. And our website is lasergalena.com.
Excellent. Lasergalena.com. Once again, this is Dr. Agnieszka Cluchey, and really appreciate you joining us today. Hopefully this has been enlightening for people who may feel like they are out of options with surgical pain, or they're worried about upcoming surgeries and what might be going on. Definitely worth getting a look at some laser. Dr. Cluchey, thanks again, and we'll be talking again soon.
Yes, thank you very much for having me.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.